concerns this morning over Pope Francis's health. The 88-year-old remains hospitalized in Rome, with doctors adjusting his treatment for what they're calling a complex respiratory infection. Joining me now to talk the severity of the Pope's diagnosis is Dr. Daniel Culver, chair of pulmonary medicine at the Cleveland Clinic. Doctor, thank you for your time this morning. Appreciate it.
Good morning.
Let's talk about this, a polymicrobial respiratory tract infection. What is it, doctor, and how serious are we talking, especially for an 88-year-old?
Sure. Any kind of an infection in an 88-year-old always makes us anxious compared to somebody who's younger. The tolerance for infections just isn't as great. Polymicrobial implies that there's more than one microorganism causing the infection. This could be several types of bacteria, or maybe a bacteria and some other type of organism, for example. And when we hear of polymicrobial infections, sometimes that means that there is more than just an infection. There may be some underlying lung damage, for example, that can lead to a problem like that.
Yeah, I was going to ask if it was indicative of maybe some other health issues he's undergoing. He just recovered from bronchitis. As you mentioned, he's had part of his lung removed before. He uses a wheelchair because of sciatica, knee pain. He had colon surgery in 2021. Is that par for the course for somebody of his age? Or, I don't know, do some of those stick out to you as being abnormal?
Well, I think by the time you're 88, he's done remarkably well. I think that many people who are at that age have issues like sciatica and other orthopedic problems. The lung resection, as I understand it, was fairly routine, and not very much of the lung was resected. And so I don't think that really caused much problem over the lifespan with his lung function. I would think that maybe now with this current issue, that there could be other issues happening in his lungs, like some inflammation of the airways, or perhaps some other problems that are leading to some damage of the lungs and that allow a polymicrobial infection to set up shop there.
And Dr. Culver, if you were overseeing him and his medical care right now, I mean, what would be your main focus and kind of your course of action here?
Well, I like that they're adjusting the antibiotics. I think the very first thing is making sure that you have the right medications on board for the organisms. If there is a polymicrobial infection, again, we have to understand why somebody's lungs would become vulnerable to that. That could be airways inflammation. It could be things like stomach acid or stomach juice getting into the lungs. Sometimes that causes a polymicrobial infection. It could be an area of scarring or damage in the lungs. And so the first step is to really treat this current infection by adjusting the antibiotics. The second step is a preventive one, making sure that mucus is cleared from the lungs and any structural issues are addressed, like chronic microaspiration.
It sounds painful. Do you think he's in pain right now with this, doctor?
Most people with pneumonia don't have a lot of pain. Interestingly, the original reason why he had lung resection, as I understand it, was pleurisy, which is inflammation of the lining of the lung, and that can be quite painful. So if he has an element of pleurisy, that could be painful. But I think with pneumonia infections, usually we hear of other symptoms much more, like shortness of breath and sometimes quite a bit of coughing, which can be very bothersome if it really gets going.
Okay. Well, we're wishing him well. Dr. Daniel Culver, thank you for breaking it all down for us. We really appreciate your time and expertise this morning.
Thanks for watching, everybody. Go to joinnn.com to find NewsNation on your television provider. Also, don't forget to click that red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.